What up, everybody, and welcome back to the podcast. My name is Robbie Cassidy, and on this episode of the podcast, we're going to look at the management of ankylosing spondylitis. Now, this is a very specific or niche podcast, and the reason being is that I got asked, in the Back Pain Back to Exercise group, we've had people that go through it who have ankylosing spondylitis, and they wanted me to go into a little bit more detail on that specific case. So what I did here is I went through the research, picked out some of the things that could be interesting or important, and to give you a better understanding of why you need to manage it certain ways, as well as how you can manage it, and give you a little bit more background into what's going on as well. Try and make it a bit more condensed so you can take it away and you'll have a better understanding of the issue itself, and the management principles for the issue. Okay, so to jump straight into it, what is ankylosing spondylitis? Well, it's an issue that mainly affects the spine. It causes back pain, stiffness. You've obviously limited movement or limited range of motion, and it's generally related to the inflammation that goes on. Now, it also can affect different spine joints, and it can lead to structural changes, as well as obviously with that you have reduced quality of life. And this is the thing I want to talk about in this podcast, is how we can improve quality of life and how we can get back into an active lifestyle to start to build on that. Okay, because quality of life is the most important thing when you're dealing with a chronic issue like this, because if it takes over, it can really, it has a huge impact on it. Okay, so when you're looking at ankylosing spondylitis, the joints obviously become a lot stiffer, a lot more sensitive, and then you get pain with it. Now, you can also get widespread pain in other areas like the hips, the knees, the shoulders. So it's not just specifically in, let's say, around the spine or the sacroiliac. It does go to other areas, and it can involve the joints and the ligaments as well in those. Now, when you're looking at the type of issues or the type of pain with it, it's, as I say, it's kind of around the sacroiliac joint. There's certain points in the body as well that it can pick out, but basically pain in the sacroiliac joint, SI joint at the bottom of your back, just in case anyone, at the bottom of your spine, for anyone who doesn't know the location, where the spine meets the pelvis, and then in ligaments and tendons, where they attach to the bone as well. Now, the inflammation itself, it can start in the sacroiliac and it can start to move to the ligaments and tendons afterwards, all right, and depending on the severity of it and the degree of what you're dealing with. But what we need to understand is just because we have inflammation doesn't mean that we always have pain, all right? And it's a point that I'm going to talk about throughout the podcast, and I'm going to keep coming back to, because it's one that's it's an important thing to understand. Because once we get that idea in our head, once we start to understand that we can have this inflammation, we can have this wear and tear, we can have these structural changes, but that doesn't mean that we're always going to have pain with them, then it changes our perspective on what causes a flare-up, how to treat a flare-up, and how to improve it overall. Okay, so that's the first thing. Now, as the issue progresses, or depending on the stage of it, you can get these calcium deposits as well in the ligaments and around the discs of the spine. And in time, you can get bone spurs off of that, depending on the severity of it. And the bone growths are called syndesmophytes, okay? But they're a sign of that the ankylosing spondylitis has started to become a little more progressive, and in certain cases then they can fuse together, and that's obviously more severe cases. Now, the diagnostic procedure of it, this is something I won't, like, there's a lot on this about like how you go into the areas that they check, but that's more from a medical standpoint and a physiotherapy standpoint, and it's not going to be as beneficial to you. So the basic way that how they diagnose ankylosing spondylitis is that they use medical imaging, and then that is combined with a family history of, like, does anyone in your family, any close relatives have it, and they talk back, and that they also will ask you about the symptom assessment. So they obviously look at an objective assessment of your range of motion and the pain that you feel going through different positions, as well as subjective, what it's like in the morning, what it's like in the evening. Does it wake you up at night? Once you start moving, how does it feel? If you're inactive, how does it feel? So there's the diagnostic procedures are fairly in depth to actually get a diagnosis of ankylosing spondylitis. And as I said, then they use medical imaging as well to kind of combine all of them together before they can pick it out. So it is important. This podcast is not, I'm not going to do this podcast to diagnose it. I'm going to do this podcast for the people who have already been diagnosed with it and want to know what to do outside of that. Okay, so once we have an idea that it's an inflammatory condition, it can become a chronic condition, And it obviously is associated with limited range of motion. It's obviously associated with a lot more pain, stiffness, discomfort, and can affect your quality of life on a day-to-day, where you feel that you can't do things because of the pain that's there in the background. And you feel, first off, there's with any injury, any chronic injury, there's always a lot of fear around it as well, where you don't want to do something that's going to make it worse, because you don't want to be in a position that a flare-up happens and then you're stuck in that position for the next 4 weeks, 8 weeks, 10 weeks, okay? And it's something that's rarely addressed when you're looking at these chronic issues, because oftentimes they just address the symptomatic nature of the issue itself, where they say, okay, well, if we can give you non-steroidal anti-inflammatories, if we can give you corticosteroids, a really interesting one, ankylosing spondylitis as well, you'll often get the Achilles, you can get pain in your Achilles, okay? But it's contraindicated. You don't want to be getting the corticosteroid into the Achilles, because then you have a higher chance of Achilles rupture. And the same thing is with medical management. You want to keep pharmaceutical management with any of these issues to a minimum. And that doesn't mean that you don't take it at all. Obviously, that has nothing to do with it. It's more that you want to reduce it, and you want to take over the lifestyle factors and work on controlling the controllables as much as possible. And that is really the key to management of any type of injury, whether it is acute or whether it is chronic, is you can use what you can, or you can use obviously the medical profession to really help you progress, but you still need to take care of the other factors. You don't want to just rely on anti-inflammatories to get you through this. And that's why I'm going to talk about the pain side of it and the management and what you can do with how to get back into exercise, and what the research actually shows on the exercise, or what exercise can do for these type of conditions. And hopefully then it'll give you a bit more motivation to start to work into it. And then at a certain stage, then when the motivation wears off, you'll have the discipline to keep going. And one thing about the research is very interesting. You get this with all physiotherapy research. They always talk about motivation, but the thing about motivation is it's such a fickle thing. Like if you wake up, if you sleep poorly, you will not have the motivation to do something the next day. You just don't. So I think that when I was reading through it, and I kept on seeing this pop up where it was like one of the main factors for improvement is adherence to the program, and that's dependent on the motivation of the patient. But why don't they have a specific part of that program that focuses on not using motivation to get you to do the program, and using discipline to get you to do the program? Because discipline can be trained. You can improve your discipline. But as I said, motivation is going to be up and down depending on the day. So when we are talking about the management side of things, I would like to just throw it in there that you can choose discipline, but you can't really choose to have motivation. And discipline means getting it done even when you don't want to do it. And that's what will determine how you will get on long term with these issues. And that's something that I push in the Back Pain Back to Exercise course. It's in video 1 of week 1, where I say we aren't relying on motivation here anymore. Because if you rely on motivation, it's so easy to chop and change and do different things and try out new things and say it's not working. Instead, we rely completely on discipline of setting times, making sure we remove as many obstacles as we can so we can get things done in the time that we get them done. And then when they're done, that's it. We don't have to continue doing them all the time. And when you start to get into the habit of that, it's something that you're able to build on. Like discipline is a skill. That's what people think, oh, he's either born with discipline or he's not. It's a skill that is refined and honed over many weeks to months to years. And anyone can do it. So it's something that I want to put in there, something at the core of all of my programs, the core of everyone that I work with. I always talk about this idea of making sure that you are relying on discipline and you're not relying on motivation to get things done. Because when you think about it, if you weren't required to get up and work at 9 o'clock in the morning, if you were relying on motivation to get up and work at 9 o'clock in the morning, you're not going to do that. Especially if you're working a job that you have to travel for an hour and you have to do all these other things, you're most likely not going to do it. But you are disciplined to get up at 8 o'clock every day, get ready and go to work. That's an element of discipline. So when people say to me that they don't have discipline, all you really have to do is just isolate a couple of situations in their life and say, look, you have discipline in this situation, you have it in this situation, let's just use that same level and try to improve it in another thing. It doesn't mean that you go absolutely like 100% monk mode where you're able to just start getting up at 4 o'clock in the morning. It doesn't. It means that if you get up at 8, Instead, you try to get up at 7:30, where you give yourself the extra 30 minutes. And every time you get up at 7:30, you make sure that you reinforce yourself. That's good. I'm happy I got up. And you kind of let yourself know that, positively reinforce that you got up at that time. And you slowly but surely build on that and work backwards. Now, if you miss a day, you can continue to work on it again. This is the thing. If you miss a day, just make sure you don't miss 2 days. And that's as simple as it is. It's not like what a lot of people do is they'll miss a day and then they'll just drop it completely. But if you understand that it's going to happen, you're going to miss a day, you might miss 2 days, but as much as possible, you try to keep it like if you miss one, you make sure that you get it the next. And that's really what builds discipline, because then it reinforces to you that even if I do fall off the wagon a small bit, I can get back on it and I can start to build again. So that's why when I'm going to talk about the management of it, I want you to keep in mind that there is an element of discipline that needs to be worked on, or that needs to be involved to actually help clear up this thing and help you to get back into having a good quality of life. So when you're looking at the physiotherapy aspect of it, what the main thing, it's a really important aspect of treating ankylosing spondylitis. But the goals from physiotherapy are to reduce pain, to improve your mobility and your movement, decrease the morning stiffness, and then enhance overall function, well-being, quality of life, and then get you back, as I said, to like more of an active-based lifestyle where you're not being controlled by the diagnosis and that you have more of, you have control over your life and your lifestyle. That's the goal of it. And you can do this through exercise programs, and obviously education are two huge ones. Now, the exercise programs can also be combined with breathing, because there's elements of it that your breathing gets restricted when you have ankylosing spondylitis, or AK I should probably just call it from now on, where your rib cage is restricted, and that can be through pain and stiffness, tightness, and a lot of discomfort there. So it is an element that needs to be worked on as well through deep breathing, where you take these big inhales, you hold it, and then you're looking to take like a longer exhale. And all you're doing there is you're expanding the rib cage, because if you let it take over, it will slowly but surely it will shut off what you use. And not that it'll shut it off as much, but you're going to get more pain and sensitivity around the rib cage when you start to take deeper breaths. Okay, so it's something that you can train. And if you really practice like taking a nice deep breath, really expanding the rib cage, opening it out, holding it for a couple of seconds, like 5 seconds, 10 seconds, holding it there, and then exhaling. You can breathe out through your nose, or you can breathe out through your mouth, whatever works for you. But practicing, you'll feel it tight, you'll feel it sore, but the more times you do that in the moment, the better it will get. And when you're going after an issue like this, you have to expect that the first 5 reps are going to be a lot more uncomfortable than the last 5 reps. So you do your 5, then I would say do another 5 in the middle that you're kind of just getting right into it. You're starting to notice that it improves, and then try to do another 5. And then do that a couple of times throughout the day, where you actually set time. Okay, I'm waiting for the kettle to boil here. I'm going to take a nice deep breath. Inhale, really open out that chest, let your shoulders back and down, stand up nice and proud, and then you can just breathe out nice and relaxed. Now, play with it as well. As with any type of a program, it's never about just being completely strict. You need to, when it's a body and you're working on the body, you need to adapt it to your own body. So I always say, you'll always hear me talking about like trying to play with, if I give someone mobility exercises, like in the back pain back exercise group, I say play with them a little bit. Try them out. See what you can do. If you can move your arm up or down, if you can change your head position, how does that work? Is there anything that you can do to make it work better? Now, in a simple case, when you look at a breathing exercise, what you could do, just as an example, is you could take a nice big inhale, and then you could hold it, and then you could rotate while you have the inhale held. Okay, so you're actually opening up other areas of the rib cage that may not just have been hit through the breath alone. So that way you would inhale, and then you would do rotations left to right and up and down, and then you would exhale, nice and relaxed. And then you might actually change it again, and you might do belly breathing, where you take a big inhale into your stomach and see how that feels, and then inhale into the chest and see how that feels, and the same thing, nice and relaxed out. Okay, and then when you take a full exhale out, then you might rotate again. Okay, do you see? I hope you see what I'm doing here. I'm not trying to be so strict to say you have to do this. Do 3 by 15, whatever, 3 times a day. You can do that, perfect. But the more you play with it and the more you mess around with it, you'll notice that you'll improve a lot faster because it becomes a bit more like a game. And when you are looking at rehab and you're looking at like physiotherapy or getting back into this active lifestyle, you need to test it out in different ways. You need to change it up. And that's why doing those little changes where, as I was saying, inhale, hold. Inhale and try climbing stairs. Inhale, bend down. Inhale or exhale fully and rotate. Try do it while you're doing mobility exercises at the same time. Okay? So with exercise programs, you can do home-based ones, you can do them in group classes, you can figure out what ones work best for you. And what I'm going to talk about, because a lot of the research actually shows, is that aerobic exercise is a very effective method of improving the quality of life and improving the symptoms. Okay? So it should be some way personalized, so it's something that you enjoy, as opposed to just saying, okay, do these exercises and do them every single day for the rest of your life. That becomes boring. So it's like trying to find an activity that you enjoy and build towards that. In the Back Pain Back to Exercise group, we use running to get back into it. And we looked at trying to build it up to like a 5K. And then when people get back to the 5K, you look at integrating into like a group where you might join a park run on a Saturday and you go down and you do that. Or you might have 2 runs during the week that you do by yourself and then you do one in a group. You might join a running group, or you could go with your family or your friends. And making sure that with the activities that you're doing, the sports or whatever ones you choose, that there is an element of community to it, but there's also an element to it that you're getting a nice exercise stimulus from it at the same time. Okay. Now, the education side of things is so important, and this is where I talk about the pain and managing pain. Now, we have to understand that you can have pain with no injury, and there's factors that will cause your pain to be higher on one day and lower on the same, even if there's no change in any mechanical factor, okay? And what I mean by that, and a really simple example, is if you go out on a Saturday night and you drink a load and you only sleep 4 hours and you get up on a Sunday when you're hungover, just check in on your body and see how it feels. It's going to be a lot more tight, you're going to be a lot more sore, you're going to be a lot more fatigued, and you'll have more discomfort. And that's just a natural factor of the fatigue with the sleep deprivation, the dehydration. Okay, and that, so you can see that there was no mechanical change. It's not that you went out drinking and then ran a marathon and woke up the next day. It's that you went out drinking, you slept poorly, and then you were dehydrated. So that means your pain goes from a 4 out of 10 up to an 8 out of 10. Okay, so we need to understand that. Now, that's obviously a very severe acute example. So let's look at it longer term. Let's look at work is really busy and one of your kids is sick. Okay, so the stress of work is increasing over the space of a 4-week or 5-week period because you're building up to a project. So you're noticing your pain has gone from a 3 to a 5 and it's getting to a 6. And now your child gets sick, so you're waking up multiple times throughout the night to make sure that they're okay. Now so you're adding the stress of work in with the sleep deprivation. So now it goes from a 3 to 4 to 5 to 6, and you add the sleep deprivation, and now it gets to an 8 or a 9. That's how you get these big flare-ups. Okay, and that's what happens is that's the nervous system sensitivity has increased massively. So it can increase acutely, as I say, after being hungover and drinking, or it can increase chronically, where there's a lot of other factors that are playing into it as well. And there's a lot of conscious factors that you may not realize as well, where you avoid pain, you become very afraid of pain, you catastrophize pain, you make it out to be the worst thing, you fear pain. All of those things can actually drive your pain to be way higher. Anyone who's just listened to this podcast for the first time, like, as I said, I'm Robbie Cassidy. This is what I talk about in so many podcasts. Check any of them out with understanding your chronic back pain. Check out the do's and don'ts of back pain. Just go through any of the podcasts that I have here and you'll see that I talk about this consistently. There's factors affecting your pain that you need to take care of if you want to improve the pain or get rid of the pain. Now, if you don't take care of those factors and you continue to look at taking non-steroidal anti-inflammatories, or you continue looking at corticosteroid injections or painkillers, you're never really going to get to the bottom of it. And I use the example of, it's like if you have a hole in the roof and you just keep mopping up the floor and cleaning the water off the floor, which is like taking painkillers where you're masking it, instead of just trying to work on the hole in the roof, which is the fact that you've been sleeping 4 hours a night. Okay, so these are all huge aspects of the Back Pain Back to Exercise group. These are big things that we lean into at the start. It's building good foundations so that we can see what we need to improve on outside of those foundations. And that's what will take the pain from a 9 out of 10 or an 8 out of 10 back down to a 2 or a 3, back down to a 1, and back down to a 0 by just building on it over time. Okay? As I said, you need to be educated about what's going on. And in the back pain back to exercise group, there's a huge part of the course that we just talk about that specifically. Okay, where we talk about the factors that contribute to your pain and how to take sensitivity down. So another huge part of it as well is when you understand these factors are contributing, your chances of success increase dramatically because you are, first off, you're more committed to what's going on. And obviously with commitment, you can get a little bit of motivation. And it's a lot easier to be more disciplined because you'll notice, okay, well, yesterday I stayed up watching movies late. I didn't exercise or I didn't do anything all day long. I only sat down and I ate shite food, and I wake up today and I'm feeling a lot more pain. And then you'll say, okay, well, I can actually work on this today. So the discipline naturally kicks in because you don't want to feel the same tomorrow. So when you do understand that these things can cause or can contribute to the pain, then you can work on it by putting things in place that will help you tomorrow. And it's such an important part of it. And that's why just giving people exercises for these type of issues is never really going to help them long term, because they'll do the exercises, they'll build up a good tolerance, and then something else will go off, whether their sleep is wrong, they're dehydrated, whatever else is causing the pain to drive it up, and then they'll lose motivation, they'll lose discipline because they won't see an improvement because they've just been doing the same exercises over and over again and they haven't noticed it changing, or they've been doing the same exercises and the pain is still increasing. So that's why it's so important. Now, aerobic exercise. There's a lot of research on the use of aerobic exercise for ankylosing spondylitis. What is aerobic exercise? It's things like running, cycling, swimming, walking, hiking, and they even included HIIT exercise in this. Now, I would have myself thought of HIIT exercise, high intensity exercise, as like an anaerobic, but still. And also you could include gym training underneath the aerobic aspect of it as well. Now, why is it important? Well, so here's an interesting one related to this. A Swedish study found that people with ankylosing spondylitis had a higher chance or higher risk of cardiovascular disease than the general population. Now, why is that? So when you look at that and say, okay, well, is that because of the disease or what is it? It's very hard to draw correlations from this because the pain is obviously going to limit what you can do exercise-wise, or it's going to limit what you feel you can do exercise-wise. So is it causation or is it correlation? Because you have a lot more pain that you start exercising as much. So that's the thing, is do you have a higher risk of cardiovascular disease because people stop exercising earlier because of the pain? Or is it the other side of it, that there's genetic factors to it? What I always say is that in these cases where they don't really understand what it is, it comes back to controlling the controllables. And if there's a factor, if there's a behavior related, if there's something that's behavior related that you can work on, that's what you go after. You don't focus on the things that you can't control, you focus on the things you can control. And behavior is one of the things you can control. That's a choice. So that's why you need to start working on aerobic exercise. And a lot of times when they were looking at patients, they had significantly reduced aerobic capacity, and then they related that to a higher chance of cardiovascular mortality. So it's like, okay, well, their aerobic capacity is lower. Now, as I said, is that because of their exercising less, or is it because of the genetic factors? You have to focus on the things that you can control, which is so important. And that's why, from my perspective, from a rehab perspective, you're trying to improve these things. You're trying to get better with them. You're trying to have a better quality of life. So there's, as much as you can, you need to focus on the things that you can improve, because it keeps you motivated to keep working on them. Now, let's look at what the research is saying. So there was a systematic review done in 2019 for Hoven, and they checked out, they evaluated the impact of an aerobic fitness program versus just non-aerobic normal physiotherapy. It was a meta-analysis, 6 studies, 300 patients. It was an intervention and a control, and all the studies were controlled, and most of them were randomized. Now, what they found is there was a significant improvement when people introduced walking, running, or swimming into their program or their routine. There was a significant improvement in their cardiorespiratory fitness as well as their mental health. so that they felt like they were obviously improving objectively, but then their quality of life, their levels of happiness, their mood, everything was improving with that as well because of the aerobic exercise. Okay, which is huge. That's so important to understand that. There was another one done, 727. They looked at aerobic walking, Nordic walking, hiking, running, swimming, and exergaming. I don't even know what that is. I guess it's exercise with gaming, where they're playing games, I guess. And they found it was like between 3 weeks to 3 months, and there was again another massive improvement in aerobic capacity. Now, with that one, they were like, because there was so many different studies, they were like, well, which one is the best? They don't know if it was the walking was the best, or the swimming, or the exergaming, or the hiking. So what you can take from that yourself when you're listening to that is that it's about finding the ones that you can do consistently and that you can work on consistently. So if that means that if you're someone who likes to go down and the guys are playing 7-a-side soccer on an AstroTurf and you want to go down, you play a little bit with those and you build it up over time, perfect. If that's it, there's a walking group that you join and they go for walks twice a week or 3 times a week, or they go for longer hikes, ideal. Go after that. Join those. Or if there's a run that you like to do yourself or a walk you like to do yourself, do that, okay? Find things that you enjoy doing and do them consistently. And that's the factor that made the biggest difference. So because we knew that the aerobic exercise was going to improve, the next factor that they need to check is people's discipline, people's consistency with the exercise. Doing it one time is going to help. Doing it 3 times a week over a year or 2 years, 5 years, it's going to have a massive improvement on your life. So it should be considered as a therapy for ankylosing spondylitis because of the potential benefits in reducing cardiovascular risk factors. Now, there was also alternative forms that they looked at as well to see how they would affect the physical and psychological outcomes. And some of the research looked at yoga, they looked at Pilates, and they looked at Tai Chi. And it was, from the research, they all had similar benefits. Not as much on the aerobic capacity, obviously, and the cardiovascular side of things, but from physical strength, symptoms, psychological, like from mental health, they had a significant impact on that as well. So when you're looking at the alternative ones, it's finding again a form that's going to suit you and suit your lifestyle, and it's going to help you the most. So just really it comes down to understanding the general benefits of exercise and what you can gain from that, and then mixing that into what actually suits your lifestyle. Okay. Now the key thing here is that you're not living by the diagnosis, and you're looking to have a positive outcome. You're looking to improve it over time because it's possible. That's why I wanted to show the research, just to show you that it is possible to improve over time when you have a structured plan and you have something that you're working on and working towards. So as with anything, to manage the issue at hand, you have to identify what the biggest problem is. If pain is the biggest issue, you need to focus on managing the pain. Okay, if limitation or if your fitness is another issue, you need to focus on improving that. So this comes down to understanding your specific condition, understanding what's contributing is key. And then the better able you are to do this, the less you'll have to deal with flare-ups, because you'll know, okay, when, like one I always throw out is that people, like accountants, when you're looking at pain flare-ups, accountants generally have them closer to the end of a month, end of the year, because of the increase in stress. All right, so that just shows that if you can start to pick out, well, I need to work on things around this time of the month. For other people, it could be something different. And for you, it's about understanding what's contributing to it so you can fix it. I just give you that example so that you can think about yourself. Well, when do I get the biggest flare-ups? When you look at it over a year span, when do I get the most? Is it in the winter? Is it in the summer? Is it the spring? Is it the autumn? Is there certain months? Is there certain activities that it's involved with that I feel it more? And not being married to these new beliefs that when you start to understand them, just being aware of them and being aware, okay, well, in January, after a couple of months of the winter, I notice that it gets a little bit worse. So I need to make sure that I have a plan made so that in January I start to work on these factors. So I can work on the emotional side of things and the mental side of things as well as the physical. Because obviously in January, things are a lot harder to get going again just because of the dark weather and everything, middle of the winter side of things. So the better able you are to understand what's going on and contributing, the easier it is to improve and fix it. Now, it takes time to get back, obviously, but it's achievable. And as I said, it's about making sure that you're not just living by the diagnosis and letting it control your life, and instead you're looking at making 1% improvements from an exercise standpoint and an education standpoint every day. And that can be through breathing exercises that you're doing. It can be through aerobic capacity. It can be through learning about what's contributing. It can be through leaning it, like understanding the pain, listening to it, touching off it a little bit, seeing how it feels, and then nice gentle movements and saying, okay, well, I actually feel a little bit better today. And make it a longer term plan, setting long term goals, because there is a way around every obstacle. So to finish off, what can you do? As I said, first off, do not be afraid to exercise. In fact, it's going to be one of the most important things to help this issue and to improve it. Now, pain and flare-ups are generally caused by other factors that trigger the flare-up. And then you get the cascade of events that happen after it. So sleep and stress are huge. They're massive in this. Exercise and activity are another big one. Hydration is another one. So if you manage these, you can improve your quality of life massively. And as I said, it's moving away from living by the diagnosis and letting that control you, and instead looking at a lifestyle that you want to have. If that's, I want to be a healthy, active person. If that's, I want to play, or I want to be a runner, or I want to be a hiker, or I want to climb mountains. Looking at that lifestyle and saying, or I want to play with my kids. I want to be active with my kids as they age and my grandkids as they get older. And looking at that lifestyle and saying, okay, well, if that's the case, what do I need to do to get there? And then putting a plan in place to actually start to work it. Now, when you start to put the plan in place, you start to look at what activities you enjoy and you start to build on them. You say, well, if I can get out and walk 3 times a week or 4 times a week, that's going to improve everything around me. It's going to improve my mood. It's going to improve my sleep. Everything will build on that. If I can go to the gym, that's going to improve my strength. Okay, what one can you do more consistently? Can I go for a run? Because then that will obviously, if you can do that consistently, you have an area that you can go to run in, or if you have a treadmill or whatever it is, that's going to help you long term as well. So set the goals, don't limit yourself, and when you need help, look for it. Seek help when you need it. Reach out to people who can obviously get you back into this, or people who've been through it before and are working on improving it. If anyone has any questions at all, just shoot me an email at info@themobilitytutor.com and let me know if you have any questions. Or on Instagram is RobbieCassidy_. And you can just shoot me any messages you have there. If there's anything you want to go over, or if you have any questions on what would be the right thing to do, or any like what exercises or what is the best plan of action, just get in contact, and I have no problem at all. I'll do my best to help you out. Otherwise, the last thing I would say is that the Back Pain Back to Exercise group program that we have is closed at the moment. So it's going to be open again. I haven't picked a time, so it depends on when you're going to be listening to this, but I'm going to add a link in the bio here. And what you can do is, if you go in and you sign up for the program, it will automatically enter you in the next group. And I'll probably in the next couple of weeks I'll pick out a time for the next group. So if you go in and you click in that, you'll get all the course details. You can start working on it yourself. You can start looking at the education side. You can start understanding the pain and what's contributing to it. And you'll have the exercises to work on. You'll have the running plan to build up. And then when we actually get the group program going with the Q&As, because we're running it right now, so you get your Q&As and we have the live calls and all, you'll have a really good background of what's contributing, what's going on, and then you'll be able to slot into the group and you can progress even further in that point. Or if anyone has any questions or wants to work with me directly, just shoot me a message as well, and I'll see if I can fit you in. Things are fairly full right now, but when a space opens up, I'll make sure to let you know, and you can jump in if that becomes available. So that is all from me right now. I hope that was able to help you out. One thing I just want to go over as well is make sure you do the breathing every day. It's going to help, just in case people forgot about that. But as I said, hopefully that helps you out. If you know anyone dealing with this issue, I'd love if you could send them on this podcast. If you check out the other podcast, Do's and Don'ts of Back Pain is a really important one. Understanding your chronic back pain, how movement helps pain, and just scroll back through them and look through them, because I have a lot of podcasts. The very, very last thing is, if you could, please, I would love if you could scroll up to the top of this, if you're on Spotify or iTunes or whatever medium you're listening to this on, and if you could rate the podcast. I want to get the podcast up to 1,000 5-star ratings, and it's way off that right now, but it's a goal of mine. And when I do, then it'll allow me to get on much bigger guests and experts in different areas to talk about these, and so that you will have more people to listen to, and different perspectives on these issues. So I would love if you could rate it or share this with a friend. But that's all for me today. Hopefully you're doing well. And I will chat to you all again next week. As I said, Robbie Cassidy _ on Instagram, or info@themobilitytutor.com if you have any questions. Have a good one.